Hi everyone, my name is Lee Henry. The vulnerable population I have chosen is African American single women with children in poverty. During the 1980s, black mothers were the most common family type. Over half of all African American families were run by single mothers. Historically, being a single parent is more common among African Americans than Caucasians. The most common reason for single parent homes in African American households is due to these mothers never being married. According to one of the references that I've used, there's over half of African American families developed as a result of children being born out of wedlock, and a large number consist of teenage mothers. When single mothers are young and lack education, it causes them to have more responsibility. Many of these single mothers apply for welfare to assist with providing for their families. One of the most common policies developed to assist those in poverty is TANF. TANF is short for Temporary Assistance for Needy Families, and it was designed to assist families in needs. The key social problem associated with this policy is poverty. The families who qualify for this program are mainly low-income single parents. Biopsychosocial factors that I believe are incorporated in this vulnerability is having a lack of education. That is one of the most important things that I viewed as a reason for poverty, because if you lack the knowledge and resources, then you don't know what to do and you don't even know where to start. Those who lack education can be a result of them attempting a poor performing school or not completing school. Some even drop out of high school, and some of them never go to college. There are a lot of women who drop out of school to be parents full time to their children. And I think that is a very hard decision to make. And I wasn't in that situation, fortunately, for having a support system. But the women that do that, they kind of put themselves in a disadvantage because they cut off their education in order to provide for their family. Many of the client population who do receive TANF are sometimes viewed negatively by those who are considered wealthy. They are stereotyped and said to be worthless and even scammers of the system. Many feel that they have the same opportunities as others and they just don't use their resources. In evidence, as an example of evidence-based practice, a social worker in an agency can work with a teen mother and assist them with applying for TANF. They can show them the resources that TANF provides and get them to incorporate that in their lives. TANF's impact can also be observed in child welfare agencies such as the Department of Human Resources. In current welfare improvements, there has been more collaboration amongst TANF and Child Protective Service agencies. There have been new plans and programs designed to decrease the risk of child abuse and neglect within the community of TANF. Intervention ideas that I suggested ways to empower the population by implementing some changes to the TANF program. Creating changes to the policy can minimize some of the factors that make individuals qualify for assistance. Changes for the TANF program can include adding educational benefits to the program, expanding time limits based on the family's need, and providing independent living skills. As stated earlier, a lot of individuals lack education who are in poverty and on welfare. And if the TANF program can incorporate some type of education to assist with them getting their GED, high school diploma, or even college, I think that that would be very beneficial to those who are receiving these benefits. That way that in due time, when their time does run out, they have something to fall back on and they can actually obtain their education while receiving the assistance. Another intervention that I suggested was expanding the time frame for benefits. There's already a time frame, I believe, that's been established, but if we can expand it, or I guess make it, make it personalized to the person's own personal experiences and their own issues, that could help them as well. In social work practice, workers can also advocate for their families. They can also advocate if the family really needs this assistance, and this can be implemented in an ISP or a CFA. The last thing that I suggested as far as intervention was teaching these mothers independent living skills. These skills can educate them on maintaining a household. This change is needed so that these women can have something to lean on. They can know how to take care of themselves and their children. They can know that they can still succeed while being on government assistance. This population just kind of related to me so much that I just really wanted to shed some light on it. I hope you all enjoyed my presentation, and thank you.